Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is one of our favorite times. This is your chance to ask any questions that you have of me live. You can just put them down in the chat below. This is also the opportunity we take to answer your questions that you've submitted onto our videos. Remember, you can also find us on Facebook, Instagram, and Twitter for additional content, and we link those in all of our videos. And you can also ask questions over there, and we try to get to them here. Please share the channel with your friends and family. And remember to hit the subscribe button so you can get our latest content. And if you hit that notification button, you'll get notified when we post a video. And please feel free to also make any suggestions of any content that you would like to hear about. Oftentimes you guys have some of the best suggestions out there. So, again, if you guys have any questions, please feel free to put them into the chat. And I'm going to go ahead and get started with some of the stuff that we saw on the videos this week. So we get a lot of questions every week about bleeding. Bleeding is one of the number one concerns that most women have when they are pregnant because it is so scary. And of course, we wonder what's going on because it's usually associated with something that's going wrong. And what most people don't realize is that sometimes it can be completely normal. So I am going to start by reading one of the questions that we had. According to my last period, I'm 10 weeks pregnant. Yesterday, I started bleeding with some small clots. I went to the emergency room and they did blood work and an ultrasound. Doctor said I'm measuring a lot smaller, just at 6 weeks. They couldn't find a heartbeat, but they said maybe it's because I'm too early. They said it was a threatening miscarriage. Now I have to get more blood work next week to check my hormone levels. I had 2 miscarriages before, but those were a lot worse because I was bleeding so much more. Currently, I am just spotting. I am so scared. And so for this viewer, if you're listening, I'm really sorry to hear that this is happening. And it does sound very scary. And so this is one of the things that I wanted to address. And we have another viewer who is in approximately the same time period during their pregnancy, which said, is bleeding with clots normal during the 7th week of pregnancy? So let's start with this. We see a lot of bleeding during early pregnancy. It can be actually very common, and there's a lot of different reasons why we'll see bleeding early in pregnancy. For starters, you can have your regular normal menstrual cycle after you've become pregnant. A lot of people don't realize that. For some women, they can go on to have a period for sometimes a couple months, even though they're having a very successful, very healthy pregnancy. So, that's the first time that you might see bleeding. The second is implantation bleeding. So the egg gets fertilized. Your baby is made in the fallopian tubes. You've got the uterus, and then up to the sides going to the ovaries is your fallopian tubes. And in there is where the egg and the sperm fertilize. And then that egg travels down and it has to implant into the side of the uterus. When that happens, there's something called implantation bleeding. And this can occur as that placenta basically starts to get established, that little teeny tiny placenta that exists there. And so this is a very common time that you'll see some spotting or bleeding. Now, so far, the 2 things that I've mentioned are very, very normal and can be seen very early on in pregnancy. Now, once that's happened, you can also see bleeding caused by having sex. So the hormones that sustain a healthy pregnancy thin out the vaginal tissue, making it very easy to tear. So we oftentimes will see some spotting, and that can be associated with sex. It can also be associated with even rough wiping. Sometimes you'll see bleeding that is associated with infection. So these are all very common signs. And then there is also something called a subchorionic hemorrhage, which we will get to later. Now, Once you have this, what you need to know about bleeding is if you see any type of bleeding present, you need to let your healthcare provider know. As I mentioned in the first question, this individual was smart. She went to a hospital to get checked out, and this is why we want you guys to call. Bleeding can show up as pink, red, or brown, okay? And if you see any of these colors, you want to call your healthcare provider or go to a hospital so we can check you. First, we usually do an ultrasound. The ultrasound is designed to see, do we see a baby? Do we see a heartbeat? How big are you measuring? That kind of thing. And then the blood work. So the way we know that somebody is pregnant is when they test positive for something called HCG, or human chorionic gonadotropin. This is the hormone that says you're pregnant. So that's when you urinate, that's what they're looking for on those pee sticks, okay? But to actually determine whether you're having a miscarriage or not, generally speaking, it's that same hormone in your blood. And what we do is we draw your blood, test for that, and then a couple days later, we draw your blood again, as indicated in her question. If the hormone levels are going up, that generally speaking means that your pregnancy is going well and continuing as normal. If the hormone levels are going down, that usually means that you're having a miscarriage. And the reason why it's important to do blood tests is in the case of this viewer, they mentioned that they couldn't see a heartbeat, but they could still see a baby. So the thing is that the only way to know for sure whether you're pregnant or not is to get those hormone levels trending. The other thing is if you pee on a stick at that time without getting that evaluation, it would show as if you were pregnant, even though you might be miscarrying. So the final part of these two questions, clots. Clots are kind of chunks of blood. And early on in your pregnancy, you should not be seeing clots of blood. In fact, that could be a miscarriage. So it's very important if you're seeing kind of pieces of blood come out that you call your healthcare provider immediately or go to the hospital so we can check you out. There are some medical emergencies like an ectopic pregnancy, which is where the eggs like implants into the side of the fallopian tube. This would be a medical emergency, and sometimes you can see some bleeding and clots associated with that. So even though that's oftentimes a sign of a miscarriage, we also want to check out for other things. And just remember, even though some of these things look like a miscarriage, and I don't mean to mislead anybody, unfortunately, a lot of women will experience a miscarriage with bleeding. There are other reasons, which is why it's so important to be assessed. So I see we got a couple people in the chat. Hi, Ali. Hi, Z. I'm going to go ahead. So I see your question. Good evening, ma'am. My bleeding stopped exactly 16 days. But then now the doctor said I have a vaginal bacteria. So I was given metronidazole, and I'm still in my first trimester, and I'm so worried. So this is a great question. The first thing I'm going to do, Z, is I'm going to look up the medication because I want to make sure I confirm what I have seen. Okay. So metronidazole is safe for use during the first trimester, safe for use during all the trimesters. So let me explain. Metronidazole is an antibiotic that specializes in a few of the bacterial vaginal infections that can occur. Not all infections are sexually transmitted, and usually this is used for bacterial vaginosis, which is actually an infection of natural vaginal bacteria. So sometimes our pH gets out of alignment. That's your acid-base balance in your vagina. It gets out of alignment when you're pregnant because the hormones that sustain a pregnancy can kind of make everything a little off down there. And so sometimes you'll get this bacterial infection, which is very normal, very common. So then we give metronidazole, which is an antibiotic to treat this. Now, why is this so important? So what we take for granted is how serious an infection can be in a pregnant woman. So what you need to understand is once you become pregnant, you are considered immunocompromised. This is why COVID-19 was so devastating for pregnant women because your immune system is weakened. If we had a super robust immune system as pregnant women, our immune system would attack our babies. because the babies are like a foreign invader in many respects to our body. And so the body needs to not kind of focus in on this foreign object that's inside of us. And therefore, our immune system kind of pulls back to allow for this healthy pregnancy. But as a result, we also are prone to getting more infections. This includes viruses, fungal, bacterial, and yeast. So we need to make sure that we're addressing these. This is a great question coming off of bleeding, because we were just talking about bleeding during pregnancy. And one of the causes of bleeding can be infection. If an infection is left untreated, it can lead to miscarriage, stillbirth, and preterm birth. This is why we give antibiotics and stuff if they are needed. So metronidazole is absolutely safe for use during your first trimester. I would definitely recommend you take it and take it as directed, because this could help prevent further complications. Now, one of the things that's tempting, and I love to talk about antibiotics, is as a pregnant woman, we tend to be very nervous about putting stuff into our bodies. And so that's why, you're asking the question. You want to make sure you've done your due diligence and everything's good. Well, once you start taking that medication, you need to take all of it. This is a mistake that a lot of people make with antibiotics. So here's what happens. When you take an antibiotic, the wonderful thing about these medications is within like a day or two, you start to feel so much better. And so a lot of us think the antibiotic has done its job. We're all better. We can stop taking it. And since we took less medicine, it's better for the baby. This is actually wrong. So what happens is the antibiotic initially will kill off a ton of the bacteria, like a lot of them. So think of it like the front line. They're killing off all the weak front line. But in the back, there's a lot of stronger bacteria, and they're watching what is going on. Now, when you stop taking the antibiotics, say on day 3 or 4, what happens is that those stronger bacteria, they still haven't died. Only now they know what medication you're going to use and how to protect themselves from it. So in a couple of days, you start to feel worse again. You think, oh, I'll take the medication now. And what ends up happening is it doesn't work. And then we have to use a stronger medication. So this is why it's so important for you to take all of your medication exactly as prescribed by your healthcare provider. Now, I mentioned it as if it's like a 7 to 10 day course. Z, your doctor may have prescribed it for a shorter amount or a longer amount of days. You just follow whatever they have prescribed. Hi, Ali, I see you. Thank you so much for joining us. Feel free to keep putting questions into the chat, and I love answering some of this stuff. And so one of the things that I'm going to say is that we had a patient who actually asked a question. My doctor prescribed me amoxicillin for a week at 38 weeks, 3 days pregnant. But my baby is big, and we were expecting for labor pains to start soon. But I've also heard that antibiotics prolong pregnancy, and this is worrying me. Can antibiotics delay labor? So this is an interesting question that I had to think about, because I have never seen them delay or keep you pregnant for longer until I thought about it from the perspective that an infection can cause preterm labor. So what I'm going to say is this is probably something that kind of is one of those like old wives' tales that people tell each other because this is what they've heard. And in theory, if you have an infection and you take an antibiotic that successfully treats that infection, yes, you will stay pregnant longer, but it doesn't specifically keep you pregnant. Now, as far as some of you may be wondering why you'd be getting antibiotics at 38 weeks, 3 days, of course, she might be sick, but also you might be being prophylactically treated for GBS infection or group beta strep. And we have a video on that we will link into the description. But a GBS infection is where a natural bacteria, also located near the vagina and the anus, kind of colonizes. And we want to kill that off before delivery, because if the baby comes out, the baby could get infected with GBS. So after the baby's born, we usually do some blood tests and keep an eye on the baby to make sure the baby doesn't get sick. If the baby's showing signs of a GBS infection, we would also treat the baby with an antibiotic like amoxicillin or penicillin. But that was a very excellent question. But no, in technically, an antibiotic does not keep you pregnant for longer. But of course, if it prevented you from going into preterm labor by successfully treating an infection, that would be a good thing. So that was a great question. We had a question on induction. What can one do to avoid the induction of labor if one's EDD has passed? Okay. So EDD, for those of you who don't know that, that's estimated due date. So that's the date that they think you're going to reach 40 weeks and your baby is supposed to be born. And so once you reach 40 weeks, if you haven't had your baby, it seems like most healthcare providers will start a countdown, okay? At 41 weeks, you are past due, okay? The risk of being past due is now the placenta is old. And so every day that passes, that placenta is going to start to not work as well. It's going to degrade, which of course is not good for your baby. So usually between 40 weeks and 1 day and 40 weeks and 6 days, we're kind of trying to see what's going on, and we're trying to allow you to go into labor naturally. But once you hit that 41 weeks, they want to induce you. They want to get the baby out because they want to make sure that you don't have any complications, that baby does well. So how can you avoid an induction? Sometimes you can't. It's going to happen. But one of the things you can ask your healthcare provider to do is some natural things to help you go into labor. And we have a video on that we can link into the description. Some of my favorites are pumping. Okay, so you can get a breast pump and you can actually pump the breasts, and that will stimulate oxytocin. And oxytocin is that hormone that helps reduce contractions. The other nice thing about pumping is that sometimes you'll get a little bit of colostrum. That's that first breast milk. If you label it and freeze it, you can actually give it to the baby once the baby is born. Now, some other options include rocking on an exercise ball. You might be able to use some supplements like primrose oil. And, honestly, very honestly, sex. Sex is actually very good for helping to induce labor. For starters, when you have an orgasm, you release oxytocin. So that same hormone that starts contractions. So having really good sex with an orgasm can start contractions. Also, male semen has some prostaglandins, and prostaglandins are the hormone that helps to soften the cervix, to help ripen it and get it ready for labor. So this is actually another very natural way to try to get your labor started. You can talk to your healthcare provider and see what other things that they suggest. And finally, you might be able to ask them to strip your membranes. So you have the uterus, and inside the uterus is the amniotic sac. That's the bag of water that your baby's in. And that amniotic sac has these membranes that kind of attach to the side of your uterus. And so what they can do when they sweep the membranes is, if your cervix is open just a little bit, what they do is they go in there with their finger and they kind of sweep like this to separate that bag from the side of the wall. Now, they're not separating the placenta, just the bag. Now, this is kind of painful, just so you guys know. It's not one of the most comfortable things that you'll ever go through. But the idea behind it is, once that separates, it will release some hormones that will help to tell the body, hey, it's time to go into labor. It's time to get this party started. So that's another way that you sometimes can stimulate labor. If labor is going to start from sweeping the membranes, it usually starts within a day or two, but it's not an instantaneous thing. So I would talk to your healthcare provider about some of these options to see if any of these would work for you. Now, we talked earlier about subchorionic hemorrhage. And one of the things that we talked about were bleeding. And I mentioned subchorionic hemorrhage, which is one of the common causes of bleeding. So we have one on subchorionic hemorrhage. It's my first pregnancy. And the spotting started before IMP, which I'm assuming is implantation. And now my week 7 spotting continuously. And in week 7, bleeding started with clots. Is this a sign of miscarriage? And so we spoke earlier about bleeding with clots early on could be a sign of miscarriage. But she is also mentioning a subchorionic hemorrhage. So subchorionic hemorrhages are a common cause of bleeding during pregnancy. So what is that? So you have your uterus and the placenta attaches to the side of the uterine wall. This is the organ that feeds your baby. And the side that attaches is covered with little blood vessels because those blood vessels are going to feed the baby through the umbilical cord and filter out the toxins through the umbilical cord. So it attaches to the side, but sometimes underneath you'll get a little pooling of blood. And this is a subchorionic hemorrhage. And it's a pool. And so that pool can sometimes drip through underneath and it comes out in the form of spotting or bleeding. Subchorionic hemorrhages are actually pretty common. And so what ends up happening is we see it a lot. And so you'll have some bleeding. You go into the hospital to get that ultrasound and they see this hemorrhage underneath the placenta. There is nothing we can do about it. Nothing. We just have to wait and see. But what is also kind of nice about a subchorionic hemorrhage is most of the time they resolve on their own. So let's say I'm in week 7 and my subchorionic hemorrhage is this big on the placenta. Well, as my pregnancy progresses, my placenta is going to get larger and larger and larger. But that subchorionic hemorrhage stays exactly the same size. It does not change. So even though the placenta is getting larger, the subchorionic hemorrhage is actually getting smaller and smaller and smaller. And eventually it can actually just resolve on its own. It just goes away. So it's very possible that a subchorionic hemorrhage can cause you to bleed and have some clots, but now it's like dissipating very quickly. And so that's a really cool part of understanding what's going on and knowing like what your body's doing and why things aren't always as it's not always a bad thing to see these things. I had a friend who bled very heavily for all 3 of her pregnancies for the entire time and had 3 healthy babies. So the most important thing is to keep going back, keep telling your providers and let them check you out. So Z, I see, okay, the medication is for 7 days. I already took 3 days, but was planning not to continue because I was worried about the effects. So Z, I'm really glad that you asked the question. You definitely need to take it for the entire 7 days. Again, even though you might be feeling better and the symptoms might be going away, there is still bacteria there that is just waiting. But if you keep taking the medication, it's going to eventually kill those off. Now, here's one other thing that I want to tell Z and everybody else. If you are not sure about a medication and you want to double check, the other person that you can check with is your pharmacist. So pharmacists have specialized training in medication. I have training because I took classes that specialized in medicating women who are pregnant and postpartum, as well as seeing those utilized during my experience in the hospitals. Well, pharmacists get specialized training on the chemical content, the half-life, all sorts of other stuff. And so they are a great resource to let you know what the latest research says about using these medications. And all of us should be able to tell you the risks versus benefits of a medication so you can make an informed decision. So that's another good resource. Hi, Tess. So I'm 6.5 months postpartum, and I've been doing baby-led weaning for 2.5 weeks, 2-ish weeks. I breastfed and then pump before bed. I used to get 8 ounces total, and over the last month have been dropping to only 3 to 4 ounces per pumping session. Is this normal, and should I be concerned about my supply? So this is a great question. So once we introduce more food other than just breast milk, a lot of women will experience a drop in their milk supply. So breast milk is a supply and demand thing. So what happens is when that baby's no longer demanding as much because the baby is starting to eat other things, you see that tank. In addition, if you start to get your regular menstrual cycle, the hormones that are a part of your menstrual cycle do start to interfere with your breast milk supply. Now, it doesn't necessarily mean that you have to be super duper worried about your milk supply, depending on how the baby's doing. Babies need 3 to 5 ounces, generally speaking, 8 times a day. So that equals, anywhere from 24 to 32 ounces. By the time you're about 6 months old, you're kind of leaning towards that upper end. Now, one of the things you could do is you could boost up your pumping just a little bit to like 20 minutes a session to try to increase that demand. One of the other things is when a baby has a growth spurt, they'll cluster feed, but they'll cluster feed more as this means of like getting the body to produce milk. And one of the ways you can trick your body using a pump is a lot of the pumps start out really fast. And then after like a minute or two, they slow down and the suction kind of goes like this. One of the things you can do is you can actually at the 5-minute mark, speed it back up. So, again, it starts like this, right? Then it slows down and then you speed it back up at 5 minutes for like a minute and then let it go back into its slow cycle. And then at 10 minutes, you speed it up. And then at 15, you speed it up. And then you close out at 20, right? So that speeding up is like a baby who's going, hey, give me more milk, give me more milk, give me more milk. The other thing that you can sometimes do naturally is fennel oil. And a lot of women will add fennel oil to like a drop or two to what they're drinking every day. And that can actually boost your milk supply. If you go to my video on how to boost your milk supply naturally, I think I mentioned one of the oils that I love. But I can also say to you here that doTERRA makes a really good product. And they're one of the ones that I go to. There's a lot of other herbs and supplements that you can go to as well. I wouldn't be overly concerned at this point unless you were supplementing with other forms of liquid, which at 6.5 months, and I'm assuming you're not doing this test, but for anybody else who doesn't know, that's usually not a time that you would introduce, say, cow's milk, for example. Baby-led weaning is usually basically where babies will be allowed to start sampling foods off of their parents' plates. It's kind of like letting the baby tell you what they're ready for. And usually it's using natural foods, like foods that we eat that are just baby appropriate. They're soft, they're easy to, kind of mash up and stuff like that. So you shouldn't need to worry about it at all, in my opinion. But a lot of women do get a little freaked out. So if you want to kind of get it up to like the 5-ounce mark, I would do a little bit of pumping and maybe use a couple herbs and see how that goes. But at 6.5 months, a lot of what you're doing is you're supplementing a lot of what that decreased supply means. Okay. For those of you who are joining us, I'm Dr. Samantha. Hi, I'm the maternity mentor. We're here for another one of our live Q&A sessions that we do every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask me questions live like we've seen from Tess and Z. So please feel free to put anything into the chat and we'll try to get to them. I also answer questions that have been asked or submitted onto our videos. So I'm going to answer a question that we got about sickle cell trait. So so I am an AS and my partner is also an AS and we are pregnant. What can I do to limit the traits of having an SS baby? Okay. So sickle cell trait. You're welcome, Tess. So there are people who have sickle cell disease, and this kind of goes for a lot of other disease. Cystic fibrosis would also use this same analogy. So you have people who have the disease, sickle cell disease. You have people who have the trait, and you have people who don't have the disease. Okay. So when two people get together, they each have one of those three things. And when they combined, their baby has some kind of chance of developing sickle cell. So now if both of them do not have sickle cell, the baby's not going to have sickle cell. But when you have two parents with a trait, there's a 1 in 4 chance that the baby will have sickle cell disease. Okay? And so there is no way to prevent that other than IVF with genetic selection. So IVF is in vitro fertilization. Okay, this is where we harvest eggs out of the woman's body and take them out into a lab. We harvest the semen out of a man's body and put that into the lab. And we combine the sperm and the eggs together outside of the body. Once that fertilization processes happen, they let those eggs develop for about 10 to 12 days. And then they test them. They'll take out 1 or 2 cells and they'll test them for a variety of diseases. If they saw a embryo that was positive for sickle cell disease, then you could choose not to implant that embryo. Okay? That is the only way to prevent having a child with that disease. Other than that, if you were to do things completely naturally, there's no way to know genetically. There's a 1 in 4 chance that your baby would end up with sickle cell disease. There's a 1 in 4 chance that your baby would have no disease and no trait. And there's a 50% chance that the baby would have sickle cell trait. So that's just how and this is how all genetic diseases pretty much work, when the mom and the dad together combined create the genome. So we had a question on postpartum bleeding, and it said, "Hi, if I don't have any symptoms, but I feel like this." She had watched the postpartum bleeding video. "I have twins that are about 10 weeks old. I suffered preeclampsia and obesity. My bleeding is occasional, and when I do a lot of physical activity or carry heavy stuff, I see more bleeding. My doctors did an ultrasound and told me everything is fine, but I don't know what else to do." So normally postpartum bleeding, it lasts for about 6 weeks. This is the normal kind of pattern. And it starts out the first day with this really, really, really heavy bleeding. And then by day 2 or 3, it starts to lighten up. And by the time you're at week 1, it looks like a period, like a regular normal menstrual cycle. And then it keeps lightening up from there. And oftentimes by 3 or 4 weeks out, you don't even see any spotting anymore, although some women can spot up to 6 weeks. And it's a pretty standard pattern. After that, we usually don't see any more bleeding. And so one of the things that needs to happen is if you're seeing bleeding, you need to let your healthcare provider know. So sometimes some of the causes of bleeding can be, and in this case with a C-section, maybe she didn't heal quite right with the surgery, or maybe she has a stitch that's not dissolving properly. So the way we would determine that is by doing an ultrasound. Another cause could be a tear in the cervix, a little tiny cut in the cervix that maybe has been bleeding the whole time, but it's just small enough that it hasn't really been a problem. And another issue could be retained placenta. Now, in this viewer's case, if you're on, I don't think it's a retained placenta for 2 reasons. 1, it would have been caught on ultrasound. But 2, retained placentas over time, if a little tiny piece of that placenta stays inside your uterus, your bleeding may lessen and lessen and lessen, and then it gets worse and worse and worse again. And you end up bleeding very, very heavily. Now, the other thing is, depending on whether you chose to breastfeed or not, some women will start to develop a menstrual cycle within a month of giving birth. While it's not common, it is possible. It just depends on how sensitive your body is to the shifting hormones. So it is also possible that your body's trying to regulate into a normal period again, depending on if you had breaks in the bleeding or not. Now, what can you do? You need to keep asking the doctor to check you if the bleeding is continuous and every single day, even if you're spotting. You need to look out for signs of infection. We can bleed when we have certain types of infection. When you have a C-section, you have a whole bunch of people inside your belly, and sometimes you can develop an infection from that. So they may want to look at giving you some antibiotics. The other thing is you need to make sure you know exactly where the bleeding is coming from. Some women will mistake their bleeding for vaginal bleeding when in fact it's actually from a hemorrhoid. So hemorrhoids are the dilated blood vessels that you find around the anus where you go to the bathroom or you stool. And those are easily torn and will bleed. And if you don't realize where the blood is coming from, you can actually have blood on the tissue or blood on your underwear that's actually coming from the back when you think it's coming from the front. So it's important to really identify where is this bleeding coming from and continue to advocate for them to check. Okay. You should not be bleeding continuously for weeks and weeks and weeks. And in a couple more weeks, you're at 3 months postpartum. They really need to try to figure out what's going on. So we had some more questions on bleeding that I thought were really good. I'm 35 weeks now, and I had some bleeding during week 33. At that time, the bleeding was continuous for 1 week, and then it stopped. Now I'm bleeding a little spotting again. Is this a serious condition? Okay, so when we're early on in pregnancy, our concern is miscarriage. Bleeding might be a miscarriage, and it really might. Once you get into the second trimester, though, so in the first trimester also, there's a lot of really common reasons why you could bleed, and there's not much we're going to be able to do about it. When you get into the second trimester and the third trimester, which she is in the third trimester at this point, right? At 35 weeks, you need to think preterm labor or a placenta issue. So let me explain. You have your uterus, right? So this is your uterus. And at the bottom of your uterus is your cervix. And your cervix should be long, thick, and closed. And the two fingers actually look quite like a cervix. And what happens is it's not completely closed. There has to be this opening, right, to allow for dilation. But that opening is where your mucus plug is. This is that infamous mucus plug that'll fall out. It falls out when the cervix opens, okay? Now, if your placenta is sitting over your cervix like this, it's called a placenta previa. And we have a video on this. We'll link it. But if you start to dilate, what'll happen is this side of the placenta is covered with blood vessels. So as you open up, you're going to have some bleeding that comes through here. That is a medical emergency. If it continues, you can end up with very serious issues. How do we diagnose that? By ultrasound. So if you go and get checked out, we're going to do an ultrasound, especially at 35 weeks, and we're going to see it. Now, the second thing that usually causes bleeding this late into pregnancy is actual cervical dilation. Okay, so this is your cervix, right? So as you start to have contractions, the whole point of the contractions is to open the cervix up, right? And see, my cervix is thick here. And as I do this, it thins out because that's what the cervix is doing. It's thinning out and it's pulling up and away to allow that baby's head to come down. Okay, just like that. Now, this is tissue. This is tissue that is being pulled apart. Okay, it's like skin. It feels kind of like skin. Okay, so it can tear. And if it tears a little bit during this process, we're going to see bleeding. Okay. Also, everything inside the uterus, that whole amniotic sac that we were talking about earlier, it's separating from the uterine wall. The placenta is starting to loosen up a little bit. So there's a lot of bleeding involved in all of this. So we very much see bleeding during labor. A lot of people don't realize this, and it is considered normal to a point. But if you're in preterm labor, you would absolutely potentially see bleeding at 35 weeks, but you don't want to be having a baby at 35 weeks, which means you need to get checked out. So ultimately, bleeding into the third trimester is something you no longer ignore. And if you can't reach your healthcare provider, you need to go in. Okay. We had a question on labor and delivery. So I have been excessively tired. I've had diarrhea, horrible back pain, and some pressure for the last 3 days. I'm only 30 weeks pregnant, and this is my third pregnancy, but it's been almost 11 years since my last pregnancy. I'm nervous this is a sign of early labor. Okay, so let's talk about poop during labor. So it is extremely common for you to poop before you go into labor, like as you're going into labor. It's also very common for you to vomit. So why is this happening? So especially the poop part. So down by your vagina, okay, you have your vagina, right? And then right below that is the anus where the poop comes out. So right next to your uterus is your intestines where the poop comes from the stomach, okay? So if you're full of stool, that limits the amount of space that your body has to work on contracting the baby down to the vagina, okay? When your body has all the signals that you're in labor, all those hormones, everything that's supposed to happen is happening, your body's going to try to get everything out of your intestines to give you the most amount of room to do what your body needs to do. So as a result, it'll throw up any food that's in your stomach, and you will try to give you all the stimulation to go to the bathroom as it can to open up all that space to allow for you to push the baby through the vagina. Because once you get down to that little area, it's a very small space. You need all the room you can have. So diarrhea is absolutely a sign that you could be in labor. And a lot of women mistake that. And if you also vomit, that is another key sign. So if you're sitting at home and you think you're having Braxton Hicks contractions and the pattern's not very regular, but all of a sudden you start vomiting, you should go to the hospital. A lot of times vomiting can be one of the last signs before you get to like 10 centimeters as well. So then she talks about also being tired, and then of course some back pain and pressure. So we oftentimes hear about labor pains being in the stomach and the stomach tightening and loosening and tightening and loosening. But not everybody feels it that way. And depending on the position of the baby, a lot of women will have something called back labor. And back labor is because the baby's head is faced in a different direction than what we would prefer. So the baby kind of butts up against the spine. Back labor will often manifest as cramps or aching that comes and goes, and therefore could be a sign of labor. Okay. So if you're having pressure or pain in the back, you need to consider this to be a sign of labor. In combination with the diarrhea, this could be a real possibility. Now, ultimately, this person should be seeking medical care. But I'm going to tell you that I suspect this might not be labor. However, she absolutely needs to get care. And the reason why I suspect it might not be labor is excessive fatigue. Okay. So it's very hard when you're pregnant because you are tired all the time. By the time you get into the third trimester, you're exhausted. You don't sleep well. It's hard to eat enough because everything's like all jumbled up, and you get acid reflux and the baby's pushing on everything. It's just very, very hard to get what you need for nutrients. A lot of people have to work, so they're on their feet. It's tough. So you get tired. So then when somebody says to me excessive fatigue, it's something that I'm concerned about. But excessive fatigue is usually not a sign of early labor. It's usually a sign that you'll see at the end of labor when somebody's been laboring for a long time. But fatigue, diarrhea, pressure, and back pain could all be signs of a urinary tract infection. Urinary tract infections are extremely common during pregnancy, and they are absolutely something that should not be ignored. A urinary tract infection, if left untreated, can travel to the kidneys, which causes pyelonephritis or a kidney infection. Pyelonephritis that is left untreated can cause sepsis, which is a systemic blood infection. Sepsis can cause vomiting, diarrhea, fatigue, chills, and if left untreated, can actually lead to a stillbirth. So when you get a urinary tract infection, it is one of the most serious infections you can develop during pregnancy and absolutely needs to be treated with antibiotics. We will put our video about UTIs and into the description. One of the things that really bothers me when I talk to a lot of women is that out in the world, there's all these homeopathic treatments for urinary tract infections. Now, I am very much antibiotic conservative. I don't think we should use antibiotics for everything. In fact, I really think there's a time and a place to allow for homeopathic remedies. I do not think pregnant women should go without antibiotics for urinary tract infection. I would tell you that that is the number one infection that I have seen women in the hospital for preterm labor for. Okay. Once a urinary tract infection is established, it is very hard to get rid of without antibiotics. And remember, women who are pregnant are immunocompromised. Your immune system is trying desperately to work with you, but it's just not going to respond the same way as a woman who is not pregnant. So it's essential that you get treated. In this case, with these symptoms, it sounds like she could have had an untreated urinary tract infection that is now spread to the kidneys, causing some of that pressure and back pain. And now that is potentially converting into a sepsis type of situation. So in her case, no matter what, whether it's preterm labor or it's infection, she needs to get checked out right away. And this is why it's so important for you guys to get checked out if you think something's wrong. You have healthcare providers that signed up for a job that means they're on call 24 hours a day, 7 days a week. This is what they do. They understand that responsibility and they take it very seriously. So call your healthcare provider if you're not sure. It doesn't matter if it's 3:00 in the morning. That's their job. Their job is to make sure you and the baby are doing well. And it's so important for you to advocate for yourself and for the baby. You know, we always ask questions about whether a medication is safe, but we're afraid to call to ask a question about what's going on in the moment if it's 3:00 in the morning. Don't hesitate to ask. Hi, Gabriella. Do you use diaper cream every time you change the baby or only when they have a diaper rash? Also, which diaper cream do I use? Any suggestions? There are so many. Oh my gosh, are there so many? There is like a million creams out there now. I think it is one of the most confusing things that to try to buy diaper cream and nipple cream because there's like a billion. And they're like all these like oh my gosh. Organic, sorry. Sorry, there's all these like organic creams and like all this stuff like that and like are all natural. Like, what am I supposed to use? Okay. So, number one, if you're going to use a diaper cream, the best diaper cream to buy is the cheapest diaper cream that you will find everywhere, like on every shelf. Okay. Now, the reason for this is if you buy some fancy, organic, all natural, like the best ingredients diaper cream, how many people are actually using that diaper cream, right? So how many babies' skin gets exposed to figure out, do a lot of babies get an allergic reaction? Does it really work for a diaper rash? Stuff like that. But regular old Balmex that's found in every single store everywhere and is found like across the world, well, it wouldn't be everywhere and across the world if it wasn't safe and it wasn't effective. This is something in today's day and age that is very confusing, I think, for parents and for moms, is that we think that the best product has to be this fancy, all natural, really expensive product. And in fact, for a lot of vitamins and a lot of creams and lotions, the cheapest stuff is actually the best. So I would actually recommend something like a zinc oxide, which Balmex has one, fragrance-free diaper cream. Now, why does that zinc diaper cream work so well? To be very honest, because it's a barrier. It's literally putting a barrier between urine and stool against the baby's skin. Okay. Now, that being said, I wouldn't actually use it unless you find that your baby's constantly got a rash. One of the best ways to treat a diaper rash is actually air. It's letting your baby air out. So if you have a little boy, because of course little boys can kind of squirt everywhere and little girls can too, but little boys can make a big mess. What you can do is you can give them supervised tummy time where you put them down on their stomach and let their booty be up in the air and just put them face down on a towel, not face down, but like belly down on a towel or a diaper. So if they do pee, it's just going to go into that. and give that whole area some time to air out. Air is actually really, really good for preventing diaper rash. Another thing that's really good is UV light. So we do want to be careful with sunshine because sunshine can actually burn your baby's skin. So you want to be careful, but a little bit of sunshine, like 5 or 10 minutes, some of those UV rays and stuff can actually help to kill some of that bacteria off as well. But I usually recommend the cheapest fragrance-free diaper creams. Same thing goes for the nipple creams. All those fancy organic things, really, they're not FDA regulated. You have no idea what ingredients are actually in that product. You have no idea what the safety testing is or if it's even been tested. And you're going to have no data on a large population to see if it's really safe for babies, if it's effective, any of that stuff. So I hope that helped, Gabriella. And please tell me if you need a little bit more than that. We had a question on paced bottle feeding. It wasn't really a question, it was a comment, but I really liked the comment and I thought I would address it a little bit more. So we're going to link my paced bottle feeding. I'm glad you liked it, Gabrielle. So we're going to link my paced bottle feeding video into the chat. But paced bottle feeding is a way to support breastfeeding, a bottle feeding technique to support breastfeeding because it slows down how a baby drinks. But it actually is also good for formula feeding because it can help with GERD and acid reflux that some babies will have. And so with paced bottle feeding, if this is a baby's head, this is the mouth, right? You take the nipple of the bottle and you're supposed to start out with the nipple so that it's basically all air. And then you let the baby suck a couple times because if a baby's sucking at the breast, the first couple sucks, there's no milk. The baby has to suck to tell the breast to start releasing milk. And then you tilt it so that the nipple's half full of milk and half full of air. And you let the baby suck, and then you go down again, and then up, and then down. And you're doing about 8 to 10 sucks per kind of position. The idea is slowing the baby's feeding down. Now, from a breastfeeding standpoint, this teaches a baby to be patient. This teaches a baby to work at a bottle because they're going to have to work at a breast. This is how it supports breastfeeding. From a GERD acid reflux type of perspective, the reason why paced bottle feeding is so good is because formula fed babies, bottle fed babies overfeed themselves because when you have a bottle and you go like this, they can just go. And the next thing you know, 6 ounces are gone. They've just chugged down so much milk. Okay. And the reason that's a big deal is because the stomach does not have time to register it's full. So when our stomach gets full, if we're eating at a slow pace, once the stomach reaches capacity, a hormone is released in our body that sends a signal to our brain that says, I am full, I don't need to eat anymore. And this happens for, babies, children, adults, all of us, the same hormone. But if you eat too fast, then what happens is your body doesn't have enough of a chance to feel that fullness happening and to release the hormone, and we overeat. And that's why we feel stuffed. One of the reasons why Europeans are oftentimes a lot healthier from that perspective than Americans, and also even some of the South American and Central American cultures, is because they eat slower. And when you eat slower, it gives your body a chance to sense this. When we're dealing with a baby, if we do paced bottle feeding, right, instead of this go, the baby's stomach also has a chance to register that. But this person said it's hard to do with a newborn bottle. So I am going to agree. There's a million bottles out there. It's very hard to figure out which one's going to work for paced bottle feeding and which is not. One of the things we sometimes do, if you know that you're going to be bottle feeding primarily and not breastfeeding primarily, we actually recommend sometimes that you go to the next nipple size. And when you say nipple size in a bottle, this is what we mean. At the tip of the nipple, there's an opening, okay? And that's where the milk comes out. So newborn nipples are designed to be the slowest. So they're like the smallest. And that's because a newborn baby oftentimes can choke a little bit. They might have some swallowing difficulties, etc. And so again, if you're doing this chug, chug, chug thing, having big wide openings, they're gonna cough and they're potentially gonna aspirate or choke. However, if you're using a paced bottle feeding technique, which again, they have to work a little bit more, then those really tight newborn nipple openings may not be big enough. And so sometimes using the next level up will actually solve that problem. Okay. For those of you who are joining us, feel free to put any of your questions into the chat. We're finishing up right now, but I do have a couple more questions that I wanted to get to. And so we're going to keep going. So is it possible after 2 C-sections to have a normal delivery? This was a question that was asked on my VBAC video. So for those of you who don't know what VBAC stands for, it's vaginal birth after cesarean section delivery, VBAC. And so what happens is for a lot of women, they will have a cesarean section for a variety of reasons. And so after that, they want to attempt a vaginal birth. And that's a really personal choice for a lot of women. There are risks associated with a VBAC, which is why it's so important to understand those. So we'll link the VBAC video into the description. But what can happen, and the biggest risk that we worry about, is something called a uterine rupture. So when you have your C-section, when they open you up, they're seeing the uterus on the inside, and they have to make an incision to allow the baby to come out that way. So there's vertical incisions and there's horizontal incisions. And depending on what type of incision automatically makes a huge difference on whether you're going to be able to have this vaginal birth after cesarean section. Now, even if you have the right incision and the right timing and the right everything, there is a risk that at that scar on the inside, you can have a uterine rupture. So what happens is you're going to be having pain during your labor, and pain and pain and pain, pop, and all the pain goes away. And when that happens, you've most likely, that where that scar was has popped open, and it's now a medical emergency, and we have to take you in for an emergency C-section. So usually women can attempt a vaginal birth after 1 cesarean section delivery, okay? And there's a lot of evidence for us to try to do that for you, because a cesarean section has a lot of risks. And there's usually more risks to having a C-section than there are to having a VBAC. So this is a practice that should be encouraged. However, once you have more than 1 scar on your uterus, your risks become higher and higher for that uterine rupture. So then they have to look at everything else. They have to look at every other part of your pregnancy. Unfortunately, today's day and age, we have a lot of different comorbidities, different complications that come up, like diabetes and hypertension and age. And so we're not always able to do a vaginal birth after C-section once you've had 2 C-sections. But this is definitely something you should ask your healthcare provider. Now, the number one thing I'm going to say, and I say it in the video, if you are planning a VBAC, you need to have that baby in a hospital. I don't care if there's a birthing center that'll take you. I don't care. You need to have somebody who's ready to do an emergency C-section right then and there. Otherwise, as far as I'm concerned, it's an unsafe delivery for you and the baby. So that's my biggest stress. And you want to make sure that that's the number one thing that they're taking care of. I would also tell you that in today's day and age, and I'm going to be doing a video about birth plans coming up. A lot of women who are attempting vaginal births and want that natural experience, they try to decline certain things like fetal monitoring and also IVs. If you are planning a VBAC, you need to allow for IV access. That's that needle insertion for them to give you fluids. You also need to let them monitor the baby. It can be intermittently, but you need to do that because this is a high-risk birth and we need to make sure everybody's doing okay. We had a question on the urinary tract video. This mom was 4 weeks pregnant and she came back with high white blood cells in her urine, which is a sign of infection, as well as itching. Her pee smelled weird. And so she was told she had a urinary tract infection. She said it's her first pregnancy through IVF. She was prescribed antibiotics, but she's worried. She has been on different different hormone shots after she received the IVF transfer. And she had another UTI during a previous transfer. And she was saying that this is her 6th IVF, and she's very worried. She thinks the IVF transfers are causing the urinary tract infections. So urinary tract infections can be caused by a variety of things, including changes in hormones and also changes in your diet, believe it or not, that can like produce more bacteria. So it's very possible that these IVF transfers are possibly causing enough stress and stuff on her body to make it more likely for her to develop this urinary tract infection. What's important to understand is knowing what you can do to prevent it. So while I do believe you need to take antibiotics to their completion, there are some things you can do ahead of time to try to proactively not get a urinary tract infection. Really good hygiene, wiping front to back, cotton underwear, cotton, not any of these fancy silky things. They're really bad for our vaginal health. And at night, ladies, if you can sleep without underwear, that's what you need to do. Our vaginas need to breathe. Our vagina is very dark and moist. It's supposed to be. And the two lips, the labial lips, they're close together. So inside here, you have this dark area that is moist and warm, and it gets exposed to bacteria. Perfect breeding ground for the bacteria that causes urinary tract infection. Perfect. And then if you cover it up with fabric, forget it. It's not getting any chance to dry out. So as much as possible, you want to let your vagina breathe. And one of the ways you can do that is at night sleeping without underwear. It is really good for your vaginal health. What's really bad for your vaginal health is all those fancy creams and douches and all the sprays and stuff that they want you to use to help reduce your odor and bacteria. That stuff is terrible for you. And if anything, it's more likely to cause a urinary tract infection than to prevent anything. So I want you guys to check out that video because it gives you a lot of different things that you can do. But ultimately, urinary tract infections are a huge deal during pregnancy and something we really want to try to avoid. For those of you who are still here, thank you so much. I'm finishing up with our last comment. So if you guys have any questions, you want to go ahead and put them into the chat now. So this was a comment that came in. I get these comments a lot in this particular video, and I feel very passionately about this subject. So I go ahead and I almost always try to read them and then talk about it. So it was on the hyperemesis video, and it says, it's not morning sickness for me because I vomit from morning until noon. It's even worse in the evening. I'm losing weight because I vomit what I eat and drink. So hyperemesis gravidarum, you're so welcome, Z. Hyperemesis gravidarum is severe morning sickness. I personally am somebody who suffered from hyperemesis. So during my first pregnancy, I was hospitalized for over a week with hyperemesis, getting antibiotic fluids because I was throwing up so much. During my second pregnancy, I threw up every single day of that pregnancy up until the day that I gave birth. At 32 weeks, I went into premature labor from vomiting 8 times that day. And we almost had our son early as a result. I lost weight throughout both pregnancies. My second pregnancy, I lost weight every single time I went to the doctor. I never gained a single ounce during that pregnancy. I remember distinctly for years after having my kids, there were certain foods that I didn't want to eat because I remembered throwing them up when I was pregnant. It was extremely traumatic, okay? So hyperemesis is one of the most traumatic things that a woman can go through when she is pregnant. There are cases of women who develop post-traumatic stress disorder from this. So I like to highlight these comments for the following reason. Maybe when this woman says to you, oh, I have hyperemesis gravidarum and I am so sick, and you look at her and she's thrown up once a week, maybe she doesn't look like she has it. But maybe that's only what you see and she doesn't tell you the rest of it. So pregnant women go through a lot of change. Their body changes so much. And so no matter what you're seeing, I encourage you to support those women. And what happens with hyperemesis gravidarum is women are oftentimes not believed or they're perceived to be wimps or complainers. And it really adds to the stigma of it, and it makes you feel very isolated and alone. So when you're with your pregnant coworkers, your pregnant family members, your pregnant partners, just acknowledge what they're going through, give them lots of love, lots of patience, lots of support, because that's what they need. And just understand that it is really a devastatingly serious condition for a woman to go through, and no one can understand it unless you're sitting in it, but all of us can give support and love. So, my name is Dr. Samantha. I am the maternity mentor. We are here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, one of the favorite things I love to do, as well as answer any questions that you've given us on our videos. We are trying to be here every Monday at 9 p.m. Eastern Standard Time. We are also on Facebook, Instagram, and Twitter for additional content. Please subscribe to the channel. It helps me out so much, and I really appreciate when you do. Please feel free to hit the notification button so you can be notified of our latest content that's coming out. We are coming out with some really exciting videos. I'm going to be doing a video on the new RSV vaccine that a lot of you have requested. I'm going to be going in depth on the colors of bleeding during pregnancy, and I'm also going to talk about birth plans. So these are some exciting stuff coming up. We are here to help you as much as we can, and we really appreciate your support. Yes. Thank you so much, C. I really appreciate you. Have a wonderful night. For those of you who are still on here, thank you so much for asking questions. Ali, Gabriella, Tess, Z, we really appreciate it. I'm Dr. Samantha, the maternity mentor. Bye for now.